Hi, I'm Shamira Melko. I am the owner of Melko Dental. What I love most about being a dentist is really being with people, spending time with my patients, getting to know them, listening to them, and helping them achieve their goals for their mouth health or their smiles. But more than just being a dentist, I'm also a mom. My daughter is starting college this fall. Outside the practice, I have hobbies. I love to jog, hike, bike. I love to write and read, enjoy poetry so much, and I also write my own poetry. Restorative dentistry is the field of dentistry that's concerned with fixing the teeth. And it could be just a small problem like a cavity and filling a cavity with a filling. It could extend beyond that. A large fracture of the tooth that needs a crown, a larger filling, a partial crown, onlay, inlay. It's the science and art of dentistry that is concerned with restoring one tooth or multiple teeth, just the whole smile of the patients. It's the field of dentistry that helps by restoring these teeth. It helps improving the patient's smile, but more importantly, improving the patient's health because our teeth is the gateway to our digestive system. And they're also very linked to our breathing as well and quality of our sleep at night. Some common problems that restorative dentistry can fix, for example, is a single cavity in a tooth. That is considered restorative dentistry. We go ahead and get rid of the cavity and place a durable tooth colored filling there. If the tooth has a larger cavity, where either a cavity or a fracture has destroyed most of the tooth, then at that point, restorative dentistry will basically composed of fabricating, designing, and making a crown to basically cover the tooth, save the tooth, and ensure more durability and restorability. Restorative dentistry can even be restoring the patient's smile if it's crowded, if a patient has a lot of crowded teeth. Just aligning that smile to a more aligned, healthy smile is also considered restorative dentistry. So when someone has a cavity, if it's a small cavity, a moderate sized cavity, most likely that tooth can be restored with a single tooth filling. Nowadays, we have many durable materials that are used for that are also very aesthetically pleasing, that are tooth colored. If the tooth cavity is larger, where most of the tooth structure is compromised, or if the tooth is broken, with a large filling, or with a leaking old crown, then a crown would be a more suitable solution for the tooth to basically protect the tooth long term from additional fractures, additional leakage, and additional cavities. For fillings, we use a material called composite resin, which has been in dentistry for a long time. And the great thing that evolving research and evolving technology has contributed to advancing this material quite a bit. So nowadays, the generations of that tooth-colored composite filling, they're more durable, they're more aesthetic, they're more resistant to fracture, more compatible actually to our oral health. That's generally for filling. For crowns, there are several options. The same thing, the continued research in dentistry and advanced technology helps coming up with these materials that are aesthetic, but at the same time very functional and durable. Emax crowns are very common. They combine the strength and the beauty, the beautiful look. We also have, and we definitely have that option for our patients. We have another option that is zirconium based. They're called zirconia crowns. They're very, very strong, especially in the very back teeth with patients that are, heavy clenchers, heavy grinders. These specific crowns have great resistance to fracture. The option of like gold crowns, they're still available. A lot of people don't prefer them, but they're still available. They're still healthy, and they're also very resistant to fracture. That's also available. Decision or the distinction between deciding to save the tooth, restoring it, or removing the tooth, it's really tied to how much tooth structure is preserved, meaning like how much healthy tooth structure is left beyond the cavity or beyond the fracture of the tooth. If there is enough tooth structure, we can definitely save the tooth, and it's worth saving because really nothing replaces your natural teeth. Implants, are very successful. Dental implants are very successful, but definitely my goal in my practice is being conservative and saving as much teeth as I can, unless the cavity is very, very big. The tooth is compromised, the tooth have additional problems like a root canal that has failed, tooth has a lot of bone loss around it. It's really not worth it for the patient from the perspective of long-term predictability. It's not worth it saving a tooth that will not last long, or also that might give our patient additional problems, sudden pain and multiple emergencies. So it's better practically and health-wise to remove that tooth at that point and consider a dental implant. Restorative dentistry and being proactive about restorative dentistry can absolutely help prevent future dental issues. When a person comes to restore a cavity that is small size or moderate size, that tooth be better off health-wise and will be restored early on versus waiting long to develop a bigger cavity, because the cavities just get bigger and bigger. So definitely restorative dentistry, especially early on, can be preventing future issues. Absolutely. What I love the most, if I can help the patient preserve their natural smile, is basically, I'm helping my patients keeping their natural, healthy teeth in a healthy state, long lasting. Almost nothing will replace the natural beauty of your teeth with whatever we can help you, whether it's fillings, whether sometimes even the crowns of the teeth are, more compromised, or even Invisalign to align the crowded teeth and bring them to a healthier state as far as, the gum health around them. So definitely my prime goal is to be more conservative, conserving as much natural tooth as possible. If you'd like to make an appointment, you need to make an appointment, please give us a call at 408-720-1123. You can also go to our website, melcodental.com, and there are a lot of quick help and quick chat tools there. You can actually schedule your appointment very fast and easy online on our website as well.